With this, I want to briefly mention about tumor board settings as well, because you already saw that there's precision medicine approach and how to utilize that for non-small cell lung cancer. But what are different tumor board settings where we would discuss each of these cases? So first and foremost is general tumor boards. There are some hospitals in the country where all different kind of solid tumors or sometimes malignant hematological tumors, which means like leukemia, lymphoma, those all could be discussed at one setting. There can be one particular day, for example, sometimes it can be Friday, Thursday for 1 or 2 hours of discussion, and all different cases can be discussed. Very often, sometimes in community setting, this kind of general tumor boards can still be utilized. Second one is site-specific tumor boards. So for example, there can be thoracic oncology specific tumor boards in which just non-small cell lung cancer plus small cell lung cancer or other thoracic oncology like other lung cancers can be discussed. Third one's a molecular tumor board and precision medicine tumor board. And these are newer types of tumor boards which have evolved in the last few years as the precision medicine evolving as well. Here, focus is on molecular alterations. Whenever we do different NGS testing, ctDNA testing, basically any different biomarker testing, there are various alterations which are found. Sometimes one patient can have multiple different alterations as well. And when there are multiple alterations available, there leads to some kind of confusion on what exact treatment to be used. Those kind of cases can be taken to molecular tumor board. Fourth one is palliative medicine and musculoskeletal tumor boards. And these are extremely helpful as well. Because along with oncology care, it is very important to have palliative care approach at the beginning itself, especially in advanced setting, because that can help in symptomatic care, and it can also help in longer treatment for those patients and therefore better outcomes as well. They can also discuss about like various pain approaches, and in pain approaches, it's not just medication. There can be radiation given, there can be various different types of other treatments be given as well. And then another one is phase one tumor board discussion. So various different NCI designated centers or various big comprehensive or cancer centers across the country also have phase one tumor boards, in which cases are discussed based on various clinical trials which are available at those centers. So it can be pan-solid tumor discussion. So it can be lung cancer plus colorectal cancer plus breast cancer or kidney cancer. And then depending on various phase one clinical trials, which means that first in humans or sometimes phase two clinical trials, the trials can be offered to the patient based on multidisciplinary discussion. So those are extremely helpful as well. On this slide, I want to quickly talk about what are different teams. So first and foremost, surgical oncology. They help in identifying the best surgical candidates. The second one are medical oncologists like us, identifying requirement of neoadjuvant, adjuvant, or systemic therapy with palliative goal. So like what kind of treatment can be given, what kind of combinations can be given. Third ones are radiation oncologists. They help in again determining candidates for radiation therapy, concurrent with chemotherapy, or just for oligometastatic progression. There are radiologists as well who help us identify the staging as well as where can exact surgery be done or where can exact radiation be given. At the same time, also help us evaluate treatment responses because sometimes we are like, how much is the cancer growing or how much is the cancer regressing? And radiologists can share their expertise too. Along with that, very important pathologist and the molecular team because they can help us with various markers that are expressed not just through NGS but also through immunohistochemistry. So various surface markers which are available from tumor analysis, from the slide evaluation or various different testing, they can give us idea about what kind of newer markers are available for that patient or so on and so forth. Sometimes there are cases where we don't know where the primary is coming from, and those are called cancer with unknown primary of origin. And in those cases, various marker evaluation, which means just checking various expression of proteins, can help us sometimes narrow down that this could be coming from this particular organ. So like sometimes particular markers like TTF1 and so on and so forth, that can help us identify that this might be coming from lung cancer. And at the same time, clinical coordinators and nurse navigators, they form a big important part of this team because they can help in navigating between all these different teams as we saw. They can help the physicians, they can help the providers and practitioners in navigating as well. At the same time, they can help the patients to navigate for what next steps to be done as well. So this is kind of an overall framework where tumor board teams are made and discussions are done for each particular patient.